leveraging patients to harness digital healthcare.
Hi everyone. So my name is Dr. Gyles Morrison. I'm a clinical UX strategist, instructor on clinical UX, and I'm going to be chairing this panel discussion this afternoon. So first off, I just want to know who here actually has the LinkedIn app on your phone? The LinkedIn app on your phone. Right, if you just go to the search function there, you can always search my name, Dr. Gyles Morrison, and connect with me. That's not why I want you to go there. If you click the search icon when you're actually in the app, you'll see on the right-hand side there's an icon that looks a bit like a QR code. If you click that, it gives you the ability to share your contact details with anybody who also uses LinkedIn. So it's something I want to encourage people to do as they're here at the conference today and tomorrow as well. Use it. Connect with people. That's how you get value out of conferences like this. So, back to the talk then, to our discussion this afternoon. We're going to be talking really ultimately about how can we be leveraging patients to harness digital health, which is ultimately around the topic of patient-centered design. But before we get to it, I want to just introduce our panelists. So, first off, we have Oscar. I'll introduce you. So, it would help if I keep my notes up, wouldn't it? So, Oscar 𝐂𝐸𝐬𝐧. So you are a student engineer, sales technician for Fingertips, a startup developing an innovative aging-in-place solution providing healthcare services for vulnerable elderly patients who have restricted access to healthcare professionals.
Exactly.
We also have Tim Ringrose, who's a nephrologist come digital health specialist, co-creator of the world's first physician network, doctors.net.uk, President of the Digital Health Section of the Royal Society of Medicine, and CEO of Cognitant Group, which uses modern technologies to make healthcare information more accessible to patients and clinicians. We also have Jamie North. He's CEO and co-founder of �W𝐞𝐝, which is a recreational, mental, and spiritual fitness platform offering an abundance of in-person and online experiences and sessions via a vetted practitioner community. And then to round things off, we have got Raban, who is a veteran designer and both founder and CEO of Xploro, a patient engagement platform that uses augmented reality, AI, and play to reduce anxiety for young patients undergoing medical treatment. So, esteemed panelists, if we could just give them a round of applause to thank them for joining us. So, to kick things off then, this topic of patient-centered design, that's what I would say all of us can agree on. That's what we're really talking about here. To me, I would define patient-centered design as ultimately how do we keep the needs, the wants, the limitations of patients at the center, at the heart of everything that we're doing to serve them. But we know that this isn't really up to the standard that we need it to be in digital health. So I'm keen to hear from our panelists, why is that the case? What's actually missing? What's actually causing the problems for us to not have true, good, patient-centered design? I think I'll open that off to you.
Thanks, Gyles.
Yeah.
Well, you just mentioned needs and wants, and I think that that's a really good place to start because unlike many other industries, like the consumer industries, where it's all about what people want, in healthcare, sometimes there's a big gulf between what people want and what they need. And sometimes there's a big difference of opinion between the clinician and the patient. So if you say you've broken a leg, it's very obvious that what you want the hospital to do for you, fix your leg. If you think you need antibiotics for an infection and you go to the hospital or see the GP, they might think that you don't need antibiotics, but you might want antibiotics. So I think we've got to sometimes think about that gulf, and I think that to address that gulf, we need to provide trustworthy information to reduce that gap. But overall, my answer is that we've got a very paternalistic model of healthcare that we're gradually emerging from, and I'm afraid we've got a long way to go before we really become truly patient-centered.
Jamie.
I'm going to jump on the back of that as well. I think the big challenge is it's a very top-down approach in healthcare, and patients or individuals they feel sick, they're at home, they have symptoms, the common thing is to go on to Dr. Google, and you know, they'll always convince you you've got some sort of new cancer. So it's, I think this is a real challenge. There is no real, so previously, 𝐂𝐨𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬 platform for scientists to share raw data. So it means that anything I'm doing in the UK and you're doing in Japan, we can share that data to come to a faster conclusion. That's for scientists, so why can't we flip that around? Or, this is obviously what we're going to be talking about, but if we could do something similar for patients that enables them to not challenge doctors, because, they're super busy and typically they're there for that reason. But to give them knowledge, to provide people with some knowledge, at least then to have more of an understanding of how they feel and what they can do, because ultimately doctors do incredible jobs, but it's a trial and error process. They never actually know what a person feels as an individual. So some sort of empowerment, I think, is what we need to strive towards. Just my 2 cents.
Dom, did you have something to add to that?
Yeah, and really just building on what you two have just said, I think traditionally communication from doctors to patients has been a unidirectional thing. It's been doctors telling patients either about a treatment pathway or a diagnosis or a prognosis. And we need to involve patients in a conversation. We need to empower patients with information, and part of that is about developing health literacy in patients, because only when we do that do we create a generation of patients better able to self-manage their own healthcare. And I think, I'd just like to put that in context with a personal story. So I'm doing what I'm doing, developing Xploro, because about 11 years ago, my daughter, who was 13 at the time, was diagnosed with cancer. And I remember very clearly that she's fitting well now, by the way. She's doing great. I always have to say that because suddenly everyone goes quiet, but she's doing great. But I remember very clearly when she was ill, that she was really, really scared about going into hospital environments because no one actually told her what they were going to be like. She was really scared about any kind of treatment because no one told her what that treatment involved. And whenever there was any communication, it was clinician to parent rather than clinician to my daughter, who was the person with the illness. And at 13, she was perfectly capable of understanding information about her own healthcare. And I think we need to understand that patients need to be dealt with respect and honesty.
Yeah, thank you for that. I wanted to pick up on a theme that's emerging here on the topic of really empowering patients to take more ownership of their health. And this is something that the NHS, for those who work in the UK, or you hear quite a lot of this whole, let's empower the patient to take more ownership of their health, so they're not always having to go to the clinician. But what does that actually look like? It sounds like quite an ambitious ask because, as you mentioned, Tim, it's a very parental way of providing care as a standard. Modern medicine is that when you are sick, you go to a healthcare professional. And it's a huge behavior change to tell someone, actually, use this digital product, go online, or go and learn a bit more about your health, and then suddenly you're now taking more ownership of your health. That hasn't really manifested, even though we've been talking about this for at least since I was at medical school back in 2005. So what does it actually look like, in your opinions, or what you've actually seen in practice, to really empower patients, to really have them being able to truly take ownership of their health?
So I'm going to jump on this one.
Yeah.
I think the situation we're in at the moment, we're quite conditioned as individuals that whenever we feel pain or anxiety or depression, we reach for the medicine cupboard. This is our first kind of response, rather than actually realizing, okay, firstly, what's going on in my body? Is my gut health? Is this something I'm really passionate about? Is my gut health in order? Because your gut is the center of your health universe. There's actually 90% of the messages come from your gut to your brain. So it's having the firstly understanding of where to go and how to actually understand how to have this self-audit and how do I feel okay. And I think this is where it starts. And then previously, I guess we were at the point where you'll go to a doctor and they will give you something for your symptoms, but then it's like, what other options are there available? So is there, things like sound healing, sound therapy? These are outside your kind of the Western society of medicine, but they've been around for centuries, and they're proven to become more effective. Same as obviously psilocybin mushrooms. So one of our lead developer, he suffered from rheumatoid arthritis. Been going since he was 17 years old. Couldn't walk, but was taking medicine, steroids, etc. But then once he started taking psilocybin mushrooms, it started helping him, began to cure him. So I think, again, it's trying to bring in this more of a holistic view of medicine and understanding the self, and then that way, knowledge is power, right? So when people have this knowledge, and it's not just this one-dimensional, this is what you have, and this is your symptom, this is what you have. It's more, okay, how can I treat these symptoms? How do I, rather than symptoms, how can I deal with the cause and the root cause? It's just mine.
Tim, did you want to add to that?
Yeah, and I'd be the first to say that doctors don't know all the answers. So I think we've got to be much more open-minded about different therapies and the value that they can offer to people. But I think to answer your question, how do we empower patients? I think we've got to start with something that Dom mentioned, which is about health literacy. And there's also a link with misinformation. As you mentioned, Jamie, there's so much misinformation online. And a really interesting study by Nuffield Health Foundation from the UK in March this year looked at people's propensity to believe misinformation, so totally false information that was, without a doubt false. I think they studied about 1,700 patients. And you might think that things like socioeconomic, socio-demographic factors or political factors were really important. It was none of those. It just came down to general literacy and health literacy. In other words, the more that we can educate the general population about their health, the less likely they are to believe false information that they find. And so I think that's really the call to action that we need to do, is to really provide trustworthy, accessible information about health, and start with school kids. We should be teaching more about health in the schools. And there isn't enough of that. That's where we've got to start.
And Dom, you wanted to add?
Yeah, I think we've got to stop using patient centricity and patient-centered design as a buzzword and start actually doing it. And I think, a case in point, Gyles, you're the first clinical UX specialist I've ever met, and I've met thousands of clinicians. And that shouldn't be a rarity. It should be embedded in what you do in the health profession. It should be at the center of everything.
Yeah, I'm doing my part with training that I do of clinical UX professionals, and I think that is a big part, really, even whether it's looking at having clinicians know more about design and the design process, and how they can input their knowledge and expertise of medicine into the design of effective solutions, not just for themselves as clinicians, but also patients, because as much as they're not designing for themselves as clinicians, they still have an intimate relationship with patients, the nature of how they're having to serve them. And it's an emotionally draining service that you're giving. And with that actually means that there is a connection that you're going to form with patients. There's a professional connection that you form, which does inform your ability, empower you as a clinician to design for patients. There's still, though, as you were alluding to, Tim and Jamie, a knowledge gap. There's still a gap of knowledge, which health literacy, that can be done even from, children in school age. If they've got a better understanding of what can impact their health, good and bad, they can make better decisions. It's just like, is the latest Eternals film got a good review? If loads of people then talking about a film, then they're going to go and watch it. Something as simple as that, but this can be applied to healthcare. Is this medication? Is this diet? Is this food? Is this practice going to improve my health? Suddenly people are going to start learning about the why of it, and then start changing their behavior to accommodate that. So I wanted to shift now more about looking at patient-centered design in action, building on what you said, Dom. What does it actually mean to get input from patients? So the most obvious, as we can all probably consider, would be where you speak to more patients. But it can't be as simple as that. You ask someone what they want, they're going to give you all kinds of ideas and suggestions, but they're not designers themselves. They're not going to be experts on how to solve their own problem. They're only experts of what they don't like and what is affecting them. So I'm keen to learn and hear from the panel, what has patient-centered design look like for you in the workplace with the projects that you're working on? And maybe I'll put that to you first, Oscar.
Yes, thank you. So we would like to say that patient-centered product is very important because the patient don't know what they really need, and input are very important. So to do that, we need to deploy our product first. So when we deploy it, we design this cushion actually this cushion is designed for elder people that are not able to use their mobile phone or computer to access telemedicine, for example. You're talking about getting information, and those people that can't access internet or are not, don't have the capacity, can't access this information, so we introduce a new design to push the information to them. So basically simplifying the design. But we put it on the field and we realize that we are not patient and we don't completely know what they need and what they want. So we listen to feedback every time. We go to hospitals and upgrade our current system, go and ask for what is going wrong, what is right, what is working. And then we take note of that and we work basically on improving our current product to make it better for the future.
Yeah, I think just to add to what you've said there, it's so important that even I have to keep this in mind as a UX professional. There's so much research we can do before we make a product to help reduce the risk of making the wrong thing, but also so much research we put into it to even validate your idea. But the true way to really know if you're going to get value from a product is when it's in the hands of that user. There's no better way to understand it. Everything else before that is just reducing risk. But if you really want to show value, you've got to have a product. So it's really good to hear that you deploy a product and actually learn from it in use.
Yeah, the best lab is in the field, basically.
That's it. Tim, did you want to contribute as well?
Yeah, I totally agree with what you just said, Oscar. It's of course worth doing focus groups and talking to people before you design something. But really, you've just got to take some hunches and do some A/B testing in the field and see what works. And sometimes something that you personally think looks nice and you think makes sense makes absolutely no sense when you test it with proper naive users.
Jamie, you want to contribute as well?
It's quite interesting because if you think, I've been a patient. I've been in hospital for a couple of weeks at one point, and essentially you've got a captive audience because when you're a patient, you're bored. There's nothing else to do. So it's a real good opportunity to really, in a good way, but harvest some data and some knowledge for what they need and what they don't need. So as we were talking, I was just thinking it's just a real good opportunity to, even before to help shape your proof of concept. Even you can actually focus on one ward or one particular type of patient. And just get them to fill out a simple questionnaire around what information you want to build, to give you the information so you can build something for their needs. So it's interesting that this isn't being done already because that you're in as a patient, you're in there with nothing to do. So I think there's definitely an opportunity there.
I would say though, I think it is getting done, just not enough.
Okay.
And when it is being done, the lessons that have been learned, they're not widely shared. So as much as we get the copycatting in just general design of mobile phones or even the generic design of apps, there's a lot of copycatting going on with that, but it's very rare that the practices of learning from patients and sharing what's been learned, that's rare.
And there's also the dreaded ethics approval, isn't there?
Ethics approval.
I think sometimes people are scared that they need to get ethics approval for things that really you don't need to.
That's right. If you're not actually going to do an intervention that's going to harm somebody, you're not giving them medication, you're just asking them about how they actually live their lives now and observe and see where is there an opportunity to improve. It doesn't normally need any ethical approval. You want to add, Don?
Yeah, so it's all about questioning, testing and learning. It's all about iteration. And we've been developing Xploro for 5-6 years now, and if I can just talk about some of the things we've done in that 5-6 year journey, the very first thing we did, because Xploro is all about providing information to children who are going through medical treatment, so the first thing we did was we got some children in on week-long work placements and said, you know, what would speak to you if you were going into hospital? And these were children that had never been into a hospital at all before. The next thing we did was we got some professional ethnographers to go into a hospital setting and talk to parents and talk to clinicians and talk to patients about what they needed. And this was before we'd even begun to define the solution. And then we started building prototypes, testing prototypes with children. Our developers did things like have radiation therapy masks fitted. We got gowned up and went into a surgery so that we could walk in the shoes of clinicians and understand the process. And then one of the really transformational things we did about 3 years ago was form an expert advisory board. And our expert advisory board is a group of children. The youngest is 8, the oldest is 16. And they actually they determine the future of Xploro. They test every feature. They come up with ideas for features. They co-design features with us. And putting those patients at the heart of those children at the heart of what we do is really, really important. And what's also really important is to think that, you know, so in our expert advisory board, we've got roughly half of the group are children who've been through treatment for some kind of illness or another. And they're kind of the experts, they're the expert patients. So their voice is valid, but actually the other half have never been into hospital. And it's really, really important that we include their opinions too, because actually those are the people that our product is focused on. So it's important that you gather a broad range of viewpoints.
Yeah, I think just moving into the last question beautifully, just building on what you've just said, is, you know, patients are not all the same. They are unique. They're all individual human beings. Even if they've suffered the same disease at the same age and the same ethnicity, same gender, it doesn't mean they have the same experience. They're still individuals. And building on that further is the fact that it's very easy, especially if we're working in Europe, for example, all of us based in Europe. How are we ensuring that our products, when eventually they could be go into Africa, go into Asia, can still work? The other part of it that comes to mind is even within your geographical region, you're going to have people who have a legitimate reason to use your product, your service, but for whatever reason, not just a very obvious disability, they're going to have a problem using your product. They've got a legitimate need, but they're underserved because of their uniqueness. You know, from your experiences, just to close us out, how do we actually design for these people better?
Can I come in on that,
Sure,
Giles?
sure.
Just a couple of examples. It's always about making sure that you're talking to the users that are going to use that product. And we've got a version of Xploro that's just going live in Ghana this week. And one of the things that you do in Xploro is you create an avatar that becomes your guide through your healthcare journey, and you give that avatar a name. Now, the names that we had in Xploro would mean nothing to a Ghanaian child. So we involved Ghanaian children in thinking up what funny Akan Ghanaian names would be. When we developed our Spanish version, we produced 5 test translations by different translators, and then our Spanish children to choose which translation spoke to them most appropriately. So it's really, really important that you if you're developing a product for a community that isn't your own, that you speak to that community and you involve that community in the design of what you're doing.
Yeah, no, just to round off what you're saying there, it's that interaction with people, and I would add that you have to genuinely care about them. I think it's taken for granted in healthcare that people genuinely care. Like, as a doctor, I can put my hand up. I've definitely worked with some doctors who are right so-and-sos. They're not particularly nice people. They don't genuinely care about their patients, let alone genuinely care about their colleagues. And this is a problem sometimes we see in digital health, where we're putting profit above patients. It's a very common, you know, cliche type statement, but it's true. If you genuinely care, though, about these people that we're serving, you will serve them better. You know, thinking of, for example, as Dom, you had designed your product around how to solve a problem for your own child. There is no better motivation, really, ultimately. So yeah, I think we can close on that note. The panel, they've been great, haven't they? Let's just give them another round of applause. You can make it a bit louder. Let's pretend there's 300 people here. There we go, that's better. So thank you again for your time, and thank you for being here as well. It's been a real pleasure. And please do stay in touch. Like I said, LinkedIn, when you're on the app, go to the search. You'll see the QR icon. It's a great way to connect with people. That's the way you maximize your impact when you're at conferences like this. It's the people that makes the conferences. All right, thank you for your time.